demonstrate the setup of a MadaJet. This MadaJet could be either right out of the box as a brand new unit, or it could have been used yesterday. The point is that it's been sterilized, and we can show that in a different video. But we're taking that. This is the setup of a sterilized MadaJet. We wrap it in a standard surgical towel. Okay, so we have all the component pieces here. This is totally sterile. As soon as I touch the outside, it will be non-sterile. So now this is non-sterile, but this side is still sterile. This fill chamber, I've contaminated on the outside, but the inside is still sterile. I mount the fill chamber into the head. This is 2% lidocaine. We've drawn some up in a 10 cc syringe with an 18 gauge needle. I'm filling the fill chamber with 2% lidocaine. Now remember that there's still air in the head of the MadaJet. So the first thing I want to do is get rid of that air. So here we prime it. A few pumps and pretty soon you'll start to see the fluid coming out. See, it took me 3 or 4 pumps on a sterilized MadaJet to get all that air out and fill the cylinder with just 2% lidocaine. Once it's out, I can screw the body into the head. Now, the extended tip, we often take off to get all of the yesterday's lidocaine out of the head. So this is not tight yet. So I'll take a 1/4 inch box wrench and just secure that down so that there's no leakage around the extended tip. I test it, and you can see that it's a nice snap. Perfect. A nice single strong stream. Sometimes you can see it a little bit better if you look down the MadaJet like you're looking down the barrel of a gun. And if all you see is one strong straight spurt, you're in great shape. The spacer, or the sheath as it's called, mounts onto the extended tip. There's an O-ring in there, and that is tight enough that this is not wobbly, yet it can still be rotated so that when the vase is between your fingers, you can adjust the tip. See how I'm rotating it? So that now the sheath fluted tip fits nicely right over the vase, just like so, and now I can fire that and it'll hit the vase perfectly every time. So that's the preparation of the MadaJet, and we keep the MadaJet in a cylinder that has Madacide in it, but because Madacide is clear, we add a drop of green food coloring, and that way we can see the depth of the Madacide so that we're sure that when we put the MadaJet into the cylinder to hold it upright, that it's sufficiently submerged that we're killing any bacteria that may have contaminated the tip between patients. Now this is also an important thing, not only because of the fluted tip, but because it's a spacer. And I don't know if you can see that the fluted tip doesn't come all the way to the extended tip doesn't come all the way to the bottom. It only comes about this far. That's because a MadaJet works better if the distance between the exit point of the anesthetic and the skin is a couple of millimeters. If this were right up against the skin, it wouldn't work as well. So here, we plop that on just like so, and it's ready to go. So between patients, we'll simply return it to here and it'll be sterile.